Dr. Denny, many of us struggle with the responsibilities and restrictions that come with the pandemic. What are your thoughts about personal responsibility?
Well, thank you for having me. It's great to see so many people signed up. Once again, my name is Dr. Jason Denny. I'm a transplant surgeon by training. However, I'm also a husband, a dad, a son, and a brother. And this pandemic has affected all of us. I've been at the Henry Ford Hospital in Detroit on the Boulevard for 15 years. More than ever, our interconnectedness as Americans has been put to the test by this pandemic. Crisis has a way of equalizing the pain of disparity, but only in the short term. As cities around the country begin to return to life as usual, I'm struck by the following sentiments that I believe will prove detrimental to the communities I serve. Some of these are descriptions of the virus as the supposed virus. Isn't it really a hoax? Is it really that bad? We can't be controlled by fear. There's risk in everything. Why should my life stop because of the COVID-19 virus? All these feelings, I think, are normal, but we must trust science over the fear and bravado of walking directly into the virus and use common sense over the politics of the day. Also, communities should really think about who's really going to take the hit for this virus or who's taking the hit already. Many reports show African Americans are disproportionately affected by this pandemic, as well as other minorities. Some reports citing up to 60% of the total deaths in many cities. You can see on the slide presented there, the darker cities, the darker states are the highest affected cases. And within those areas, if you were to hone down to counties, you would see the counties that are more urban, where people live closer together, where there are more essential workers and or hand-to-hand workers are much more affected. I would urge people to really think about the total admissions that we've had. This is no hoax. Henry Ford Hospital, I believe, has had almost 1,500 admissions and a significant amount of deaths. And to really get an idea of what happens to people, Lewis, if you could put the slide of the lungs, why people have breathing problems, is that their lungs get filled with fluid. A normal lung would be completely black on either side. As you can see, all those arrows show all the haziness, and that's infection, why so many people stay on the breathing machines, and why ventilators were so important to be used and to be made by Ford and other companies, because these patients stay on the ventilator for 6 to 8 weeks. So in short, I'll let you get to the questions, but I urge you all to not attempt to do the absolute least you can do, but to do the most you can do, but not getting yourself infected or transferring an infection to anyone else. Your life, your loved ones, and your neighbor's life lie in the balance.
Thank you, Dr. Denny.